Hello everyone, my name is Lewis and I'm a healthcare support worker in A&E. My healthcare career started shortly after I finished my Level 3 Extended Diploma in Health and Social Care. This course allowed me to gain access to the healthcare support worker programme and also to apply to university. When I first started as a healthcare support worker, I was working on the wards, which was a really good start for me because it gave me basic knowledge and basic understanding on how to look after the patient and how to support nursing staff in completing their jobs. Unfortunately, the wards were not exciting enough for me and I needed something to give me a little bit more of a push to keep me engaged in my workplace. And this is when I started with the A&E team in the hospital. As a healthcare support worker in A&E, you're expected to do the exact same thing as you would on the ward. Okay, you need to maintain your patients. You need to look after your patients, you need to observe your patients, and you need to work with the nurses and the doctors to make sure that these patients are having the best care possible. There may be some differences between being a healthcare support worker on A&E and the wards, but generally it's pretty similar. The biggest difference for me is that you don't know your patients. On wards, usually patients are there for quite a long period of time. You can get to know them quite in depth, that you know how many teas they like in a day, you know how many sugars they like in their tea, you know what they like for dinner, you know everything about this patient. But in A&E, normally you don't even have enough time with the patient to sort of gather these things. You need to establish what's wrong with the patient and work with the nurses to maintain their care as best as possible, so we can sort of direct them into the correct place, which would be then into the wards or back home into the community. As a healthcare support worker, your day in A&E can be very varied, but generally this is how your day goes. At 7 o'clock, you start your handover for your patients on your designated areas. You may be placed in multiple areas within the department, but usually you'll be placed within one section. These sections can include a majors department, a resus, paediatric department, and a minors department. Personally, I like working in every area, but especially the minors department. At the start of the shift, I like to make sure that my patients are, first of all, just okay. I go in and I check and I say, how are you this morning? How are you feeling? Is there anything I can do for you? This sort of creates that bond with the patient as they know who you are. You introduce yourself and say, hello, my name is, and they know that they can turn to you if they need anything. If they're in pain, they can tell you. So then, once you've introduced yourself to your patients, you need to start going around and do basic observations. Okay, so your blood pressure, your resps, your oxygen saturation, the temperature, just basic things that you need to write down at the start of the shift to sort of evaluate whether this patient is going to need any advanced care from yourself or the nursing team or the doctors. Once you've done this, for all your patients, you may have 6, 7, 8 patients, depending on the department. It's usually around 8:30 to 9 o'clock, which is perfect timing for the breakfast trolley. I'm sure the patients will be extremely happy about that. So that's another role as a healthcare support worker in A&E, is feeding the patients. Usually on the wards, there's catering staff which go around and take the orders and feed the patients. But in A&E, at least in my health board, the healthcare support worker, that is sort of part of your responsibility. So another thing you need to think about when feeding patients is whether they're nil by mouth for whatever reason. For example, if a patient has come in with a stroke, they may need a swallow assessment to make sure they've got the facilities and the capabilities to swallow food. These are things that will come with time and come with experience. They're not things just going to happen overnight. And this is the great part of working in A&E, is you learn things that you would never think you'd be capable of. But it's a really good department to work in. Throughout the day then, you're just maintaining your patients, just the same as you would on the ward. You need to maintain their skin integrity, okay, because that's really important. You don't want any patients adding to injury sort of thing, and gaining pressure sores. You need to maintain personal care, just as you would on the ward. Obviously in A&E, there's a lot of elderly patients. They're frail. You need to make sure that they're off their pressure areas. If so, you need to order things like air mattresses to sort of maintain their skin integrity, as I said. You also need to do regular observations throughout the day. For example, in the health ward I work in, once they come into A&E, you're expected to do hourly observations on the patients for the first 4 hours of them being there. This just allows you to get a general picture of the patient's condition and what sort of care they need, whether that would be a little bit more one-to-one care, or whether they're nice and stable and you can leave them for a little bit longer. As a healthcare support worker in A&E, you're also expected to transfer patients to and from departments. So if a patient needs an X-ray or a CT scan or an MRI, you're expected to sort of take that patient from their cubicle and up, just to sort of speed up the process, because these things take time. They're having multiple investigations at one time, and we sort of need to make that as quick as possible so we can make a decision on that patient's care. And by doing that, you're supporting the doctors and you're supporting the nurses. You're making their lives easier, which is a big part of our role in A&E, is just support, because it's so stressful and it's so busy that members of staff need that sort of backbone. And as a healthcare support worker, that is your job. So as a healthcare support worker in A&E, I think there's many likes, and yeah, there are some dislikes as well. But I think if you enjoy it and you love your work, then those likes just totally outweigh the dislikes. I love the fast-paced environment. It keeps me going throughout the day, and my day literally feels as though I've been in work for an hour, because your shift goes so fast. I love to help people, and I'm sure you do too as healthcare support workers, and this is a massive part in A&E. You know, sometimes you're dealing with patients and it's their worst day of their life, you know, even if it is something like they've broken their arm or they've broken their leg, this can be a massive effect on their life. And if you can make that little change to somebody and, you know, make them a cup of tea, it is so basic, but it's very rewarding. For some people, their likes and dislikes would obviously be different with working in A&E. It's quite physically demanding, so you need to make sure that you're in good working order, and you're going to be able to keep up with the pace, because it is absolutely constant from the moment you start till the moment you finish. But this is what we're here for. We're here for care for patients, and if it's a busy day, you've just got to crack on with it and just get your head down and make sure those patients are being looked after. It also comes with the challenges, as does every job. Obviously, it's quite difficult with the things you see coming into A&E. Don't want to mention anything specifically, because obviously it's like obviously because of confidentiality and things, but you know, you do see some nasty things coming in, and you need to be prepared for that, because otherwise it can really affect you. But you need to sort of take that in your stride, and to look at it as experience. You know, you're going to learn so many new things in A&E that you would never learn whilst working on a ward or in community, simply because you are seeing everything. You're seeing general medicine, you're seeing surgical, you're seeing orthopedics, you're seeing absolutely anything, gynecology. You learn everything, so it's a really good way to sort of progress your career. But as a bit of advice from somebody obviously who's already working in A&E, I would say to start on the wards, get your basic understanding of how to look after your patient, learn how to do observations so you're confident you can do them with your eyes closed, work on documentation on pressure areas, and making sure you're writing everything down as you go along, and these things will sort of help you start as a healthcare support worker in A&E and support your future career.